If you have ever felt dismissed, told your labs look normal while you still feel awful, this session today is for you. It comes straight from a replay from our 5th annual virtual Sjögren Summit. And today, health coach Christina Russo from our Stronger with Sjögren's program and the Immune Confident Institute, who also happens to be a fellow patient living with multiple complex immune conditions, shares how she stopped seeing healthcare as something done to her and started seeing herself as the most important member of her care team. You'll learn how to choose practitioners based on qualities like curiosity, humility, and willingness to listen, why you are the hub connecting all the specialists and appointments, and how to weigh decisions by your time, energy, and quality of life, not just cost. Most importantly, you'll get reassurance that you don't need to be perfect. You don't need to have a perfect team or unlimited resources to advocate effectively for yourself. If this helps you, subscribe to the channel for more chronic illness and Sjögren support, and to access more sessions like this from the 5th annual virtual Sjögren Summit, click the link in the description for all the details. Now let's dive into this session with Coach Christina.
Hi, I'm Christina Russo. I serve as a health coach with the Immune Confident Institute's Stronger with Sjögren's program. And like many of you here, I'm also a patient living with several complex immune conditions. I was first introduced to Dr. Kara Wada after being referred to her by an insightful rheumatologist just over 5 years ago. That rheumatologist had identified autoimmune patterns in my health, but also patterns that suggested immune deficiency. Dr. Kara quickly confirmed that suspicion by diagnosing me with CVID, a primary immunodeficiency. That began my experience as a patient of both Dr. Kara and that rheumatologist. And to be very honest, it marked a turning point in how I viewed healthcare and care teams, which is the subject I'm here to talk with you about today. But before we get into care teams, I'd like to paint a picture that may feel familiar to many of you here. Since adolescence and early adulthood, I experienced a variety of health symptoms that were difficult to navigate and often not quite like those of my peers. They weren't severe enough to completely derail my life, though. They were usually manageable. So first with my parents and later on my own, we handled them one at a time as they arose. We addressed each symptom independently and then carried on. All in all, things appeared relatively normal. In fact, I was generally considered to be healthy. I live in the United States, and like many Americans, my parents and later myself did what I believe many of us are conditioned to do. We saw doctors who were familiar to us, doctors we were referred to, doctors who were nearby, and doctors that our insurance covered. I approached healthcare with the expectation that if something was wrong, I would go to the appropriate practitioner, answer their questions, and they would solve the problem. If something was broken, they would fix it with a medication, a procedure, or a treatment plan. And if I'm being honest, I largely assumed that one doctor was much the same as another. And as we all know, that model works quite well for many acute conditions. But while I won't spend time today debating the strengths and weaknesses of our healthcare system, I can tell you that it did very little to create meaningful progress when it came to my more complex and chronic health conditions. For years, I would begin exploring why I had this infection, that injury, this strange symptom, or that seemingly unrelated issue. Sometimes I made a little progress, but eventually I would run out of steam before finding any real answers. I used to call it opening a can of worms. And as many of you know, opening a can of worms is often expensive, time-consuming, physically exhausting, emotionally exhausting, or all of the above. Over roughly 2 decades of navigating my health as an adult, there were certainly a few excellent practitioners who helped to keep me afloat. But overall, I experienced far more frustration than progress. I became accustomed to feeling dismissed. I became accustomed to hearing that everything looked normal. My labs were normal. I looked healthy. Somehow those observations seemed to carry more weight than the fact that I lived with chronic pain, recurring infections, and periods where simply functioning felt incredibly difficult. Over time, I became incredibly skilled at masking, and I became what I would now describe as an overly compliant patient. I fawned under pressure. I felt guilty asking questions. I felt guilty challenging assumptions. I felt guilty offering my own observations. I believed my role was to receive care, not participate in it, to trust the experts and wait. Then life happened. Pregnancy happened and children happened. And like many new parents, my own health needs often moved to the bottom of the priority list. When I did address them, it was usually just enough to deal with the problem at hand and move on. Then, on the heels of my last pregnancy and as things began to normalize after the COVID-19 pandemic, I found myself in the offices of that rheumatologist and later Dr. Kara. About a year into treatment for CVID and still very early into understanding the full scope of my health conditions, I attended what seemed like an ordinary follow-up appointment. It's an appointment that I still remember very clearly. At the time, I still felt terrible. Physically, not much had changed. And yet, I left that appointment feeling very different. I remember walking out of that appointment with a little bit of a pep in my step. The closest thing I can compare it to is the feeling that I have after a fresh haircut. And I have to admit that it caught me off guard because it wasn't how I was used to feeling after a doctor's appointment. When seeking care for my more complicated symptoms, I was used to leaving appointments feeling frustrated or underwhelmed, often dismissed or unheard, and sometimes no closer to a path forward. But this appointment felt different. I felt validated. I felt respected. I felt collaborated with, and I felt supported. Most importantly, I felt hopeful, not because someone had solved all of my problems or because we had suddenly gotten all of the answers, but because I felt like someone was willing to walk alongside me while we figured things out together. That appointment didn't change my health overnight, but it changed the way that I viewed healthcare. For the first time, I understood that how I felt within a healthcare relationship actually mattered. Up until that point, I had mostly evaluated healthcare by outcomes. Did I get a diagnosis? Did I get a prescription? Did I get a treatment plan? After that appointment, I started paying attention to something else. Did I feel heard? Did I feel respected? Did I feel safe asking questions? Did I feel like I was being treated as a whole person rather than a list of symptoms? The bar had been raised, and once it was raised, I couldn't unraise it. I started looking at all my practitioners through a different lens. Some made me feel valued and respected. Others didn't. Some welcomed my questions and viewed my growing knowledge of my own conditions as an asset, while others didn't. Slowly, I realized something that now seems obvious. Not every practitioner belongs on my care team. That was a radical idea for me because I had spent most of my life assuming healthcare was something that I received, not something I participated in, had a voice in, or helped to shape. But the more I learned about my conditions, the more that I invested in my education, and the more I understood how interconnected my health really was, the more I realized I did have a voice and a choice. And perhaps the most important aspect was that I had responsibilities to myself. Often in chronic illness communities, patients want to know what type of practitioner is best equipped to help with their conditions. But I often encourage them to ask a different question. Rather than what type of practitioner they should see, I encourage individuals to ask what qualities they are looking for in the people helping to navigate their health. Over time, I've realized I care far less about titles, referrals, and even specialties at times, and much more about how practitioners think, how they listen, how they learn, and how they approach complexity, how they partner with patients. The practitioners who have had the greatest impact on my life have tended to share certain qualities. They're curious and humble, compassionate, continually learning, willing to listen, willing to recognize that patients often have valuable insight into their own lived experience. As someone living with multiple chronic conditions, I don't always need practitioners who know everything. I need practitioners who are willing to continue learning. I don't always need certainty. Sometimes I need curiosity. And I don't necessarily need someone to take over. Often I need someone who is willing to partner with me. Because the reality is that complex, multi-system conditions are rarely solved in a single appointment by a single specialist or through a single lens. My health journey has involved peeling back layers over time, sometimes uncovering answers, but sometimes uncovering new questions, and often discovering that one condition is connected to another in ways that weren't initially obvious. The practitioners who have helped me the most are the ones who are willing to stay engaged in that process, the ones willing to collaborate and communicate with one another, and recognize that addressing my health often requires coordinated care across multiple systems, specialties, and perspectives. Those practitioners mean more to my progress than I can adequately express. Not because they have all the answers, but because they are willing to work together, with me and with one another as we continue building a path forward. Now, for many of you listening today, I know that these ideas may sound wonderful in theory, but also somewhat out of reach. And I understand because I live within the same realities. In the United States, many of us are navigating healthcare within the confines of insurance networks, provider availability, and financial limitations. I face the same decisions. The financial burden of chronic illness is enormous. Between appointments, testing, treatments, medications, and the indirect costs of living with chronic illness, many of us are already stretching our resources before we even consider additional care options. Beyond finances, our options are often shaped by factors we can't control. Where we live, our insurance plan, access to specialists and/or teaching hospitals, wait times and transportation, our own energy or time. Those realities matter. And I certainly can't tell you what choices are right for you, but I do encourage you to keep a few principles in mind. One concept that has been especially helpful for me is to think of myself as the hub of a wheel. My practitioners are the spokes. My primary care provider, my specialists, my physical therapist, even my pharmacist, and so on. They are my care team. But I am the hub. I am the one living inside the full picture. I am the one carrying information from one appointment to the next, the one noticing patterns, the one experiencing the overlap between conditions. I am the one living with the consequences of every decision that's made. Because of that, I've come to believe that one of the most important roles that one of us can play is that of coordinator. Not because we should have to, and not because the system was designed that way, but because with complex conditions, it is often required that someone connect the dots. That realization also challenged me to think differently about healthcare decisions. To think not only about the cost, but also about the value. The value of my time, the value of my energy, and the value of my quality of life. Sometimes the least expensive option becomes the most costly when it's measured in frustration, delays, unnecessary appointments, or the years spent going in circles. Sometimes a practitioner's willingness to listen, collaborate, and think critically creates value that can't be captured on a billing statement. Again, I can't tell anyone where to spend their time or resources, but I do encourage people to think beyond immediate cost and consider the broader impact a practitioner may have on their health, functioning, and daily life. What I've learned is that building a care team isn't about creating a perfect team. Most of us don't have perfect circumstances. It's about becoming intentional. It's about recognizing that we have more influence than we may realize. It's about being willing to ask questions, to learn, to advocate, and to get creative when necessary, to think a little differently than we may have been taught to think. Because for much of my life, I believed my role was simply to show up and answer questions, follow instructions, and wait. Chronic illness has taught me something different. It's taught me that I need to become an active participant in my care, not because I wanted to, but because I had to. And once I accepted that responsibility, not as a burden, but as an opportunity, everything began to change. If today's conversation has resonated with you, I'd love to invite you to continue it with us. We'll be hosting a live interactive workshop in August on building a care team that works for you, not just your diagnosis. We're finalizing the details now, so watch for an email and a summit follow-up announcement about the event. I'd love to see you there. If there's one thing I can leave you with today, it's this. You don't need a perfect care team. Most of us don't have one. And you don't need unlimited resources because most of us don't have those either. But you do deserve practitioners who listen. Practitioners who respect your lived experience. Practitioners who are willing to learn, collaborate, and think alongside you. And perhaps most importantly, you deserve to recognize that you have a voice in your care, because whether you've realized it yet or not, you're already a member of your care team, and you might even be the most important member of it.